Welcome, friends, and thank you for listening to another episode of the Optimal Health Program. Hope you're all doing well. Today, as well, Saturday, our big show, really big show day, where we have a massive audience, including our Rumble LFA family. And we've got YouTube and Instagram and TikTok and Spotify. I think we are up to 20 different platforms on the program. Very happy to be here on a Saturday. Hope everybody will have a wonderful weekend and will avoid traffic and enjoy the beauty of, hopefully, the really nice weather. At least that's what it says on my weather app. So hopefully everyone will have some of that. A lot to talk about today. Can fiber help you to lose weight? Being sedentary and sitting may correlate with an increased risk of Alzheimer's disease and other associated vascular problems. Doing exercise and can increase the risk of having a secondary heart attack after you've had one, and probably the first heart attack as well anyway. We could talk about the signs of type 2 diabetes, how sugar damages your body. We could talk about fatigue and how many different causes there are for having fatigue. And we'll just get started.
Let's go.
Frankie, my man, is here controlling this massive electro-powered, computerized camera system here. 888-420-9272 if you'd like to call in. 888-420-9272. I know we said we had people in the queue already.
Yeah, we got people that are saying, hey, Dr. Chris, what's going on?
What's up, guys? How are you?
Shout out to the Rumble audience, to our LFA audience. Just this phone number, if you want to call us, ask us any questions, something maybe you want to talk to your doctor about, anything. You could ask it in the live chat. You can call that number under, and we'll get you live on air. So.
It's your own little personal consultation here with what we're doing. So when doctors don't give you answers or don't explain things as well as they should, then certainly we can do that. That's what I've always done. So we're happy to do that here as well. Signs of type 2 diabetes. This is a disease that's ramping up like crazy over the past decade, and worldwide statistics show that it's skyrocketing. And of course, it has to do with the inevitable ingestion of too much carbohydrate and sugar from various foods. Junk food, of course. And, people like the taste of bread, rice, pasta, oatmeal, grains, fruits. It's just when you do too much of it, as your body ages, you can't handle that constant intake of sugar. So if you're a kid, like every kid that's ever lived and had lots of carb and pancakes and cereal and et cetera and pizza, all that carb makes you produce more insulin to try to control that sugar. Years and years of doing that day to day, week to week, month to month, and your pancreas gets tired because as well you're losing new cells in your organs as you age, so you can't have the same insulin production and cover those sugars. So that's why people tend to have higher sugars and then become type 2 diabetic. Also, of course, if people are doing less activity or exercise, your hormones are declining as a result of, cellular decline in your organs. Everything plays a role. So we want to look at this comprehensively and fix the mechanism. So some of the first and obvious things we see with people that are becoming diabetic is excessive thirst. They're thirsty all the time. They need to drink fluid because their blood is becoming concentrated. There's too much sugar sitting in their blood. So your body wants to dilute that and also wants to get rid of a lot of that sugar, so you'll have to urinate more frequently. So being thirsty all the time, having to urinate a lot, is helping to dilute that sugar and then get rid of it out of your system. Frequent hunger can occur because high and low blood sugar fluctuations can occur. You can have problems with fatigue, affected vision, blurred vision, because the blood vessels in the back of your eye, your retina, can be damaged, inflamed by excess sugar effect. And sugar, as you know, damages your nerves, your blood vessels, every organ, individual cells, causes glycation, damages lipids. For people that have wounds that take a very long time to heal, that's another, significant symptom of becoming diabetic. Numbness and tingling and pain in your hands or feet. Patches of darker skin called acanthosis nigricans. Yeast infections. We know that diabetes directly correlates with heart disease and stroke and hypertension. And when these things start to pile on, and we see this all the time, I see this all the time in patients when they first come in, They've gained some weight, they're tired, they're not doing exercise, their blood pressure's up, their cholesterol's up, triglycerides are up, the other cardiac cofactors, C-reactive protein may be up, homocysteine might be high because you're not taking the vitamins to bring down your homocysteine, which, of course, we have to specify and make custom through your blood test. All of these things act together to create big problems, big damage. The risk factors for type 2, 45 years of age or older, sedentary lifestyle, obesity or overweight, poor diet, history of family, history of diabetes, polycystic ovary syndrome, being pre-diabetic. I've got to tell you, the overwhelming majority of people that I see that are pre-diabetic will be diabetic because they don't understand the mechanism. And only when we can change the picture, low carb, exercise, correct hormone decline, vitamins, etc., can we change that pre-diabetic and make them non-diabetic. And if they're racing towards becoming diabetic, then the other marvelous mechanism we have is stem cell therapy, because it'll take your cells, put them into play. Those cells will get sucked up into your pancreas, make new pancreatic cells that make insulin, and now you're changing and reversing the process. So, got some wonderful combined therapies for you.
Just a quick question from the chat: Is it the amount of carbs or the type of carb messes with insulin? Like, is white rice worse than fruit?
Well, if you look at something called the glycemic index, it's a measurement of how much sugar is in a food. So, interestingly enough, white potato has more sugar effect than sweet potato, and there may be better fiber in sweet potato. But rice is high in sugar, so anything that's 30 grams of sugar or carbohydrate is bad. Rice, bananas, apples, oranges. You could have berries because they're very, very low in sugar, and that affects. So you could take berries, put them in with cashew milk yogurt, 1 gram of carb for the cashew milk yogurt, mix it up in a blender, put a protein powder in, a plant protein organic powder that's got no sugar, and you've got a great smoothie. It tastes sweet, but it's not sweet. That's what you have to gravitate towards. So all things that break down to sugar are a problem. The bigger issue I see with grains is that they're sitting in your gut all day long breaking down to sugar. So it's a bigger effect by having the grains with keeping those sugars coming in, as opposed to having some fruit, which your body could burn quickly. The other thing that we do too is if people are dying for a piece of fruit, an orange or banana, have it right before you go to work out. Because as your body heats up and your muscles are now gearing up to do that activity, and you're burning sugar and fat, you're sucking that in, it can't really affect you.
And that's a follow-up question. Someone's just asking, is it better if I'm going to eat carbs to do it earlier in the day?
Usually, because your body is typically more active. And in the perfect world, and let's say we have a patient and they're pre-diabetic and we want to burn down their sugars, cholesterol, triglycerides, all that, lose weight. We'll tell them to typically cut the carbs down 30 grams or below per day. Do exercise every day. Some people do it first thing in the morning, which really is best. And you should do it fasting, exercise first thing in the morning, because then your body doesn't have the food in the way. It'll just burn the sugars and fats that are floating in your blood and be able to activate that system faster. So yes, in a perfect world, you want to do that exercise on an empty stomach. If you're doing the exercise in the afternoon, okay, that's fine too. For some people that want to have some of the carb, you can have that right before you exercise. Your body will burn it. So we don't tell people to do that until they start to regulate and get to where they want with their weight, cholesterol, triglycerides, blood sugar, all of their parameters. But, we can, kind of go back and forth a little bit. Also, there's an important concept. Some people can have more carb than others and get that good result. And again, I don't know which person you're going to be. So we put everybody on that same 30 gram or below carb restriction and watch to see how well they do. And if they're losing weight and their numbers are changing rapidly, we may go to 40 grams a day and see how well they do. And maybe they'll be at maintenance at 50 grams of carb per day. We won't know until we have you go through it. So the beauty is we're tracking it all and we're watching to see how well you do with that.
Someone in the chat just saying, I've heard that insulin spikes can also affect hormones, especially in women with PCOS.
Yeah,
how are carbs tied to that?
Well, sugar fluctuations, and even I mentioned a moment ago, PCOS correlates with diabetes, polycystic ovarian syndrome. So sugars can damage all tissues. The insulin spiking can make your blood pressure go up, can affect the lining of your blood vessels, can affect your organs. So that's how it may affect your ovaries as well. You may have difficulty with producing hormones, yet other people with polycystic ovaries can have excess hair in their body. They can make more testosterone and have more hair issues. So it can work almost either way.
Is sugar more damaging to insulin than starchy carbs like potatoes, or do they cause the same problems?
When you say sugar, do you mean table sugar? Because that's the sugar, the basic component, the lowest component of sugar. But potatoes do have starch, and that's carbs, so you'll get some sugar from that. Now, if people are having lots of carb, and we bring their carbs down, we get the result, and we want to bring potatoes back in, fine. Potatoes are not bad, they're not horrible for you, but when you're having too much carb in total, that will just pile on and create more of a problem. When you regulate and you get all the carbs out, your body's doing well, you can have some potato, you can have some pasta, you could have some rice, but we have to gauge it appropriately because we don't want you to go back to a level that's too much and start to spike the sugars again.
I just want to shout out our boy, Jedi Legend. I see you there in the chat. And then we have another question, a skeptic. We'll call him a fruit skeptic, saying, I've heard some people say fruit is just nature's candy. I'm not going near it.
Well, depends upon what you like. I'm not saying you could never have this or that, but in a perfect world, if we create this result where your body's burning sugar and fat and you're in a zone, you could add some of that, and fruit's not bad for you. Some people like fruit because they think that it helps them, with their bowel function, so that's not bad. It's just that I see a lot of people that are just all over the place. They're having, too much of the fruits and bananas and orange and grapefruit and kiwi, and they're having pasta and pizza for lunch. It's just they're having 300 grams of carb a day. So rather than say, well, take out these 2 or 3 things, I say just get all the stuff out, burn everything down, burn your sugar, your fat, your cholesterol, take these things away from damaging your blood vessels, your cells, your nerves, do the exercise, burn things even more, and then we can start to walk some of them back into your diet over the course of time. So it's not as though I'm recommending no carb forever. You just want to see how you get that result. And it doesn't matter to me if it takes you 3 months or 6 months to get to where you want to be. I just want to make sure that you're on that path and you're getting benefit, week to week, month to month. There's no rush to do this. If you have a lot of weight to lose, it'll take some time, but that's fine.
And just a question about whole grains, like oats and brown rice. Do they cause less of an insulin spike than refined?
No, they're still relatively high in the glycemic index, So if you take table sugar and you pop it in water and drink it, that's going to be a rapid spike in your sugar because it doesn't have to be broken down. Like an amino acid doesn't have to be broken down compared to a steak or a piece of protein that's going to take time to absorb. But the grains will just sit there for a long time and just keep releasing that sugar effect into your bloodstream.
All right.
And again, I'm not saying you can never have these things. I would just have you regulate and fine-tune your picture and then bring them in now and then.
I've had to make those adjustments, right? They used to call me Frankie Breads, all my cousins, and
yeah.
I've had to relax. All right.
Well, you got to calm it down a little bit. And you know what? Some people will go keep the carbs way down, and then for a couple of days, they'll have some carb. Why not? You can do that. If you're diabetic and you're in a bad situation, then, I wouldn't take that cheat day, but a lot of people do that, and they still do fine.
And then someone's in the chat saying, eat whole food. We talking Whole Foods or just whole food? Because we do like Whole Foods.
Whole Foods, the store, I think is a great place. I like going in there, but my wallet doesn't like going in there.
Yeah. Thanks, Bezos.
Every time I try to walk in there, my wallet's going,
how much is that olive oil? What?
Yeah.
And we have Susan saying use raw honey.
You have to be careful with raw honey because what is honey?
Sugar.
Yeah. Again, not saying you can't have a little bit of honey in your tea. It's just that when you look at how much carb people have per day, and they don't realize it, they have a lot of carb. 100, 200, 250, 300 grams of carb a day. You want to keep that tight. Drop it down to 30, regulate out, and then we can start to bring it back in, maybe go to 40. You want to have pasta on the weekend, a nice cacio e pepe or matriciana with the guanciale.
Don't make me hungry, Doc.
These are secret code words for Italians out there who know about the good pasta. You can have it. It's just you can't have tons of it every day.
Someone's talking about avoid the sugar and the fruit juice. I have a question personally. I've heard things about smoothies and because it's in a liquid form, it's more unhealthy to have fruit in a smoothie form. What are your thoughts on that?
It's just if you have a piece of fruit, it'll take a little time to break it down, get into your bloodstream. So it may be absorbed over a little bit of time. If you have a smoothie or if you have fruit juice and it's got 46 grams of sugar, on the label, that goes right in. Doesn't have to take time to break down. So when people do smoothies, they get the idea that I can have milk and I can put a banana and some ice cream and some peanut butter, and it just gets completely out of control. It's not the way it should be. What I tell people to do most often is do the cashew milk yogurt by Forager Project. They have it at Whole Foods. And it's 1 gram of carb in the plain cashew milk yogurt, 8 ounces of drinkable yogurt. Put a couple of berries in it, strawberries, blueberries, blackberries, raspberries. You put chia seeds in it if you like. Those are great for you. No carb effect. You can take a protein powder. It's Orgain is the one that I get. You can get that at BJ's because it's less expensive. And I think Costco's as well. Scoop of that in there, no sugar, plant protein, organic. Mix it all up, and there you have your smoothie, and there's really no sugar. You don't need the banana. You don't need the peanut butter because it's just a massive amount of calories. So it's just better to make them in a healthier fashion. And there are people who like the green drinks and smoothies. So they'll take something and put some celery and some spinach and the greens in it. That's fine too. If you're really dying to have it be a little bit less bitter, you can use agave or stevia or berries. There are a lot of ways to make them.
Talk about the cacio e pepe. We got a question. Do you sell cookbooks for healthy meals? Listen, if we get a few more of those requests, we'll be on our way.
Yeah, I guess I could try to create that. It just takes a lot of time to do that. There's so many good low-carb cookbooks out there. I think there are hundreds of them when you look online. And Amazon obviously started out as a book company, but you could look at some of these things, and some you could actually read the first couple of pages on Amazon. So they're everywhere.
My wife's been thinking about making one. So
she should. Why not? I mean, it makes sense. We could talk about it here and talk about different recipes. Makes a lot of sense. And some of the recipes that we've spoken about, you like some spaghetti squash, butternut squash, acorn squash. Have that. You can have fish, chicken, turkey, pork, lamb. Organic as best you can. Beef. Ostrich is great for you. And there are some people who like other sources. If you can get elk, wild boar, it's organic. These are healthy creatures living in a world where they're not eating junk food, et cetera, et cetera. So you can take olive oil and garlic, put it in a pan, take cauliflower rice, saute that in there, put some tomatoes, little tomatoes, yellow, red tomatoes, peppers, pignoli nuts if you're Sicilian. You can put some seasoning. I like Cajun seasoning, so I'll put Cajun seasoning and everything. So you can just learn how to make your own things, and, it's fun.
We got Fred in the chat saying it's the spike every day that makes you hungry. And he says, fat doesn't make you fat unless you eat lots of carbs in the same time frame.
Exactly.
Fred, I'm just going to say this. You're putting some knowledge in the chat, but as your name is Fred Stoner, so I'm thinking you're not that much of a stoner because you know a lot.
Fred is wise. Fat does not make you fat. It never did. And look at all the people worldwide who did the Atkins diet and kept the fat in the diet. And you do need some fat for hormone production. So a lot of people will do better when you maintain some fat, but the good fat, olive oil, etc., fish oil, good sources of fat. And when you keep the carbs down, you're just burning through the fat. So that's the smartest way to do it.
And then we're back to the honey, just saying that it's good for hay fever. Yeah, we talk about on the show a lot the honey, the raw honey from your local, with helping with allergies. But, we're not talking, all over.
To some extent.
Yeah.
A little bit of it might be okay, but if you're diabetic, I wouldn't do it. Or if you're diabetic and your sugar and your weight is up and your cholesterol and triglycerides are up, blah, 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 get rid of those carbs, knock them down, do exactly what we're talking about, 30 grams of carb per day or less. Exercise 45 minutes a day, walk around the block, slow, brisk, fast, etc. Indoor, outdoor bike, weights, Pilates, yoga. Correct your hormones because your hormones may be declining. You have to fix your thyroid, DHEA, testosterone, IGF-1, the active component of growth hormone, and fine-tune your nutrients. And then as you start to change, yeah, you could have it now and then. I just don't want you to slide back down the hill. The other thing that happens too is that when you're eating all the carbs, you crave more carb because your blood sugar is going up, your insulin's released, your blood sugar drops, you crave more carb. If you don't take the carb in, you're going to even out your blood sugar. You're not dumping extra insulin to cause the low blood sugar, which makes you crave. So you're not craving as much. So that's an important place to be. We want to get you into that zone so that you can stay with a reasonable diet and you won't be craving all the time.
Susan saying, my dad used to make his own peanut butter drop peanuts in the chopper.
Yeah, you can do that. And some people will take a device, I'd seen this online, where you can take nuts and make milk out of it. It's a device you can take almonds and put them in a device, and it squeezes and presses them, and you can make your own almond milk. There are a lot of things you can do on your own. Grow your own plants in a garden, in a pot. I mean, there are a lot of different things you can do, and why not?
So when I eat almonds, I don't feel like where does the moisture come from? You know what I mean?
It's in there.
It's interesting to me.
All vegetables have some moisture, and certainly nuts have, and, of course, the green leafies. But if you could, Frankie, you could look on, I forget the name of the company, but they make
juicers.
They make devices that you can make nut milk from a press.
Oh, yeah, I see it.
So why not? Go out and buy organic nuts, make your own thing.
That's wild.
And for years I've known people, and done it myself, you go out and get some nuts, put them in a pan with a little bit of olive oil. You can put a little garlic on it if you want, a pinch of pepper or salt, put them under the oven and roast them. So you've got some wonderful tasting organic, nuts. You don't have to worry about these things being exposed to whatever else, no chemicals and other things that are coming in the foods if you can do it yourself. A lot cheaper that way too.
We got some people talking about, it's true. No one's ever said this until I heard RFK just say, avoid sugar. It's poison,
Yeah.
It's like, you never hear it.
Yep.
I was given quite a few fruit snacks as a child in elementary school. All they gave us was sugar.
Of course. I can tell you for many years, and I've seen this with patients, even my friends' kids, they go out to eat, they'd say, hey, we're going to be in your area. Let's go to the IHOP. I'm like, oh, here we go. Not that IHOP's a bad place, but for kids, they get that big smiley pancake with all the stuff on it. And all of a sudden, the kids are just wired. They're just all over the place. And I think it's because of either the sugar effect or some of the stuff or the chemicals in the food.
So for this next question, I'm just going to mute us on YouTube because that's the rules. So I'm going to mute it, and then I'm going to ask the question.
Ah, okay.
Or I don't know if it's a question, but I haven't heard anything about this, so I'm curious if you have. All right. Muted on YouTube. Thank goodness for President Trump and his plans to produce the mRNA cancer cure with Mr. Larry Ellison. America will be saved. I haven't heard of anything of that.
I haven't heard about that either. There are some studies and literature say that there is a link to inhibiting a p53 gene, which helps your body fight abnormalities and malignancies. So we think that that's why these turbo cancers are popping up. That's in literature. That's not speculation.
Got it. Don't worry. We're back on YouTube. No problems. You guys don't know what we deal with, all right? All right. What else we got? Just checking for the chat. My processed oils. What's the best avocado oil or olive oil?
Olive oil may have more benefits than avocado oil, but they're both good. I'm not saying you have to use one or the other. I would put them both on board. Even fish oil. Put these things on board. They're good for you.
As long as it's not seed.
You want to have macadamia nuts. You want to have other nuts that have oil. They're good sources of oil. Makes sense.
Is animal fat best?
Is animal fat best or bad?
Best. Like out of the fats. Like, is that the...
I mean, some animal fat is fine, but I wouldn't have tons of animal fat because you don't know what that animal has been exposed to in their lives. People like to eat animal liver and such, and some of the organ meats. I don't know that that's terribly safe because you have no idea what's going on. The liver is a big filter, and everything that is in the blood goes through the liver in humans and animals. So I don't know that I would trust it.
And shout out, they said, if your wife makes a cookbook, I will be the first to buy. I love you.
There you go.
All right, you're viewer of the day. Automatically.
There you go. We're going to have to call Sabrina and, get 100 recipes maybe.
Yeah. Get some
Get
fire
100
under
recipes.
her.
I mean, it's not hard, people, Now, there are people who cook and there are people who don't. There are people who cook a little bit and there are people who cook a lot. So, I mean, but it's nice to see, and I understand a nice, colorful book with pictures and this and that. It makes a lot of sense. We'll just see if we can get her to do that.
It won't be so hard, I don't think.
No. I've seen some of her videos and stuff, and the food she makes. I can't understand you're so thin.
Yeah, neither can I.
Like 300 pounds.
Well, I had an issue a couple months after the wedding. I had to slim it down. That's why I'm no longer Frankie Breads, as you can see.
Yeah, it's tough because if a guy is with a girlfriend who's a really good cook, you're definitely going to eat more, without a doubt, just to appease the relationship and the situation. But it's nice also. What's nicer than either coming home from work or getting together and you cook some stuff together? It's great. It's a great part of a relationship. Unless they're trying to make you fat because they don't want other girls to look at you, which I have heard from some people.
It sounds like that has to be at least a percentage of the population is dealing with that.
I think it happens.
We got someone saying, I've been eating lots of animal fat, lost 4 inches off the waist.
Well, eating animal fat will make you feel satisfied and full. And look, there are people who do carnivore and just eat meat.
Well, it looks like they, with that, also limited the carbs. So,
well, yeah, the carb restriction is what's burning the fat as a primary fuel for sure. Eating meat and animal fat will make you full sooner, and that's what was part of Atkins' diet. I knew Atkins very well. I thought he was a terrific guy. Great pioneer, carried the flag for nutritional medical doctors forever. And, he was just a terrific force behind good, responsible nutritional discussions. His radio show was phenomenal. And when people did the Atkins diet, where they maintained some fat, which is good for you for your hormone production, their hormones were better than those people who did, zero fat diet. And when he kept the carbs down and people had good protein, and it wasn't people having, 150 pounds of meat a day. It was people having some eggs for breakfast, maybe some chicken with some vegetables for lunch, fish, or any of the other proteins for dinner. It wasn't insane. And people did really well. He would have eggs with hollandaise sauce. I used to go to breakfast with him now and then. Every first Monday of the month, myself and other doctors used to go to Atkins' office, rest his soul, and just discuss protocols and different things. We had an organization called FAME, the Foundation for the Advancement of Innovative Medicine, and it was a terrific. We gave lectures and stuff. It was great back in the day.
What a legend. You knew him.
Yeah, I know. He was pretty awesome. I've met some really awesome people in my life, and in the medical realm, he was one. The other most awesome person I met, which tops all charts, was Linus Pauling. So Linus Pauling was one of the most brilliant men of all time, not just in a certain amount of time. He had 2 unshared Nobel Prizes. 2. Genius beyond genius. He would give a lecture and people would be staring at him because his description, the way that he, carried his conversation was just unbelievable. But yeah, that was a really, really amazing thing.
Got a quick question here from our boy. I'm a kidney transplant patient and I want to gain muscle because I'm working out, but what can I have that won't harm my new kidney but help gain musle?
Yeah, it's
I can't have
hard to say
because
because I don't know what your blood work would show. I don't know how much protein you could have without it, it affecting your kidney. Maybe the nephrologist can give you a comment about how many grams of protein. And some people that want to gain muscle, you might need extra carb to do that. So I'm not saying you have to go out and go crazy, but for a lot of people, they can use a protein powder. It's got some carb in it. It's easy to absorb and to get into your system, so that could help. But I would need to see what your vitamin, mineral levels are, your thyroid, DHEA, testosterone, because if those are low, you're not going to be able to create that, muscle gain or strength. You know, IGF-1 is also important to look at, but that's an answer I can only give once we see what your blood work shows.
We'll see if there's a response on that. A little bit of a delay.
And then we have people of all walks of life, all types, all backgrounds. And for everybody, you know, that does exercise, we have to fine-tune that and make it work for them. I know people that are pro bodybuilders, and they eat massive amounts of food. I remember years ago, my friend Eric, Dr. Eric Fleischman, one of my best friends, that I met in medical school in 1982 on our first day of school, we walked into the auditorium, looked at each other like, oh man, are we doing the right thing? This is going to be hard. And we laughed it off. And of course, we've remained best friends since then. So I went out to see him. He lived in California for a while because he had a practice out there. He was doing, initially he did surgery, then he worked in a cancer office, then he had physical medicine rehab facilities. I go out to hang out with him. And, you know, it was kind of fun for us to go work out at Gold's Gym. The women were bigger than us at Gold's Gym. And this is in the 90s, and, you know, I would go out there a lot, and he'd come back here. But you see some of these people, and it was like, wow, how do you eat to feed all that muscle? And it was unbelievable. So there was a place around the corner from Gold's called the Firehouse. It was an old firehouse that was made into a breakfast lunch place. And I'm telling you, it was packed. Luckily, we knew somebody who worked there, and we didn't have to wait online. But there was a room in the back that had all these gigantic tables, and all the bodybuilders would sit there. When I'm telling you, there was tables twice as big as this desk filled with food, and these two guys would just be eating everything. They'd clear the whole table. You'd look at it, you know, with your eyes completely wide open in shock, but the volume of food they ate was insane. But they're working out 4, 5, 6 hours a day. I don't think people should do that or need to do that. But, you know, everybody's different. People that are older need to have more nutrients because they're not absorbing as well. They may be better off having some protein powders and shakes. It's easy to absorb, easier than a big piece of meat. Younger population might need higher nutrients because they're more metabolically active. So you have to tailor it to each person.
Chat saying eggs, lots of eggs.
Eggs are great. I love eggs. I've always loved eggs. As long as they've made eggs the villain, I've said you're totally wrong. I said that 30 some odd years ago. And recently I read a study, it's here on the desk somewhere, that, oh, maybe we've been wrong about eggs all along. I'm like, damn straight you were. You know, Atkins told people to eat lots of eggs, and when I saw that he was doing that, I said, well, let's see. Then we started doing the low carb, and, you know, this is when I first started, doing low carb, and people were eating eggs and chicken and turkey and pork and lamb, and they did great. And consistently from that day in the late 80s to now, people do great with low carb, lots of vegetables, and good protein sources. It's just a fact. People do well with an 8-hour fast in the morning where you don't eat after, you know, towards going to bed at night, and you don't have, you know, breakfast or maybe have lunch at 1 and 2 o'clock. So you're keeping that fasting state. Your body gets up and starts doing its thing, and you'll have better ability to burn sugar and fat, especially if you do exercise first thing in the morning. So we see this. I mean, the fortunate nature of what I do is I see stuff that works and what doesn't work. When people come in and they're doing certain things and it's not working for them, I can see it. I can test it. I can prove it. Then we fine-tune, we fix. All of a sudden, they're off to the races. They're doing great. But they just needed a little bit more information than they had. And for supplements, for this, for that, someone on TV says, oh, do this, do that. Some does a podcast, oh, do this, do that. They have no idea what your body's doing. They don't know if it's going to work or not, but you're buying something because they're trying to make you take this big leap of faith that what they're saying has to work on everybody. You have to understand your body first. I've maintained that for 39 years. Understand your body first, and then we can see what you need and correct that. I'm not saying you can't take some of the things that your body doesn't have requirement for. You need to correct what's required. Your core vitamins. You could add this or that on and see if it works. If it doesn't, great, no big deal. But at least you have the mechanism underway, you know?
Got a few things going on here in the chat. we're going to go back to the bodybuilders. I believe this is what this is referring to. Someone said any woman that's big is on. I don't know what this means. Possibly,
Juice.
Yeah, they said anyone who's that big is on gear. They do not possess the amount of testosterone required to build muscle like that.
Absolutely, positively correct.
Yeah.
So even the big bodybuilders don't have that amount of testosterone normally. And some of these guys are taking 2 to 3 cc's of injectable 3 times a week. Sometimes they're taking 3 or 4 different things. It's crazy, but that's what they do to get to look like that. Your body can't look like that without training that much and without shooting that much. And the women that do that, that's how they can get to be big. You see a woman who's 5'11" and 250 pounds, and she's got striations and she's ripped and her muscles are bigger than the average guy walking around. Yeah, of course, that's what does it. I mean, women have a few different kind of things that they like to do. There's some that like to run, which is great. It keeps you lean, healthy. It may not be great for your ankles, your knees, your hips if you do too much of it on a hard surface, but running's great. Elliptical stuff is great. The women who do the fitness competitions where they're in really good shape, where they've burned the fat down, but, they look normal, they look good in clothes. You're not going to see a female bodybuilder that looks really good in regular clothes because it just, you can't. I mean, but that's what they want to do. And there are other women who will, and I had a girl that worked in my office at some point, and she loved to do squats. That's all she wanted to do was squats. But she became disproportionate. Her legs and her glutes were just way bigger than what her body kind of dictated. So it's just going a little bit overboard. You want to be, proportioned. You don't have to be gigantic. It would be nice to be strong. I want everybody to be strong, every man and woman to be strong with their exercise and activity, but stay within that, nice, comfortable, safe zone. We don't want you to do so much activity. You're tearing your ligaments, your tendons, damaging your knees, your back. So just be smart. You don't have to go crazy. Be somewhere in a nice middle range and be healthy. That's the whole key. Be super healthy. Don't take risks.
I love it. Words of wisdom by the doctor. We're got a question said about the stem cell you mentioned last week.
Yeah.
I had a retinal eye surgery and my vision is poor, especially at night. Is there any way to help get vision back at all or somewhat with that?
So, yeah, I think you can get benefit from STEM because as we do the STEM procedure intravenously, and we also do a nasal droplet where you're laying on your back and we drip it into your nostril to hit the back of your nasal cavity and go into your brain, which it does. You can see videos on the website of stroke, MS, Parkinson's, Alzheimer's, etc. We've treated people with macular degeneration, diabetic retinopathy. You're putting those cells into the blood vessels that get to your retina and create brand new cells. So it makes all the sense in the world that that would be a significant benefit for you that you can't get anywhere else or in any other fashion. So that's why I love stem cells, because they're your cells. There's no downside, no side effect or risk, and you're just creating repair of your body with your cells.
I feel like there may have been a patient that you had spoken to on the program that mentioned after the treatment they noticed that colors were very vivid.
So as a gentleman who has had Parkinson's, and lovely guy, came in with a wheelchair, and he was just unhappy because he had this issue. So we did the procedure on him, the IV and the nasal, and the day that he left, he said his color vision when he left the office became more vivid. And it was like his vision went back 15, 20 years, and I was shocked at that. I didn't expect that the first day, but he called the next day and said, hey, this is what I've seen, and my vision is still good. And then it continued to be good throughout the course of a few years where we were following him up. So, yeah, I mean, that was unexpected, absolutely. Nobody would think, okay, that's going to happen right away. But it did, and over the course of about a month, he was able to get up out of the wheelchair. So your cells can go everywhere your blood flow will take them. And that's why they're so important. That's why they can work in all these different areas. Also, that's why we put different videos up on the site so that people can see, different disease or disorder types, different degeneration, and the results of the stem cells.
You're making the chat emotional, doctor.
Oh, well, that's good.
They think it's incredible. So
Thank you.
listen, if you know who you are talking about the eye thing, reach out to the office.
Yeah, certainly take a look. And I tell everybody, look at the videos on the website. I tell people every day because you can get a great education from hearing what patients have seen and the results they're getting from doing this. And again, it's not as though we say, here's the stem, and then you go on your way. We do your blood work first, examine you, look at everything, fine-tune your vitamins, minerals, hormones, the vitamin packs we're doing, which work brilliantly well. And the stem is part of a comprehensive mechanism, and we improve every single thing we can. That's why people do so well.
Incredible. And they gave me permission to mention their name, so thank you, Jedi Legend. Great. Reach
All
out.
right, Jedi Legend. A lot of Jedi people on here. Who doesn't love Star Wars? There was a funny video that I had seen, which always makes me laugh. So it's a big Star Wars party or Star Wars thing, and it's everybody, Lucas and Harrison Ford and all those people are there in the back of the room on a dais. It's a big Star Wars thing. And William Shatner walks out. And, of course, with his shtick, he says, Star Trek started everything. And everybody in the audience is like, what the hell is he talking about? And then he didn't get any response. He tried to say something funny. He pulls it into his jacket. He goes, Star Wars? It was a joke. But then the Cylons or whatever, those guys in the white outfits had to come and try to carry him away. And he did a whole song and dance number. It was really funny. Should find out if you could.
Seeing something, the FDA ran off the female doctor that could take a few vials of your blood and make your own stem cells, then inject them into, say, your knee or wherever, and they are your stem cells. Yeah.
So you can't get stem cells from your blood like that. The only way it can be done, where the FDA and all the people that are regulatory or involved are happy, is using your own bone marrow. So we're allowed to extract it. Takes a minute and a half, spin it for a half hour, put it back in. Nothing else. So that's the only way to do it. There are people that have done things that have no bearing or that have no reason, and they may be saying, oh, yeah, you're getting stem. We take your blood and we put it. No.
So you need the centrifuge, right? Because it separates, what is it?
Bone marrow.
Right.
Where all your stems live and all sorts of great things live. And you need to spin it at a specific speed at a specific time because that's all been documented by research and clinical trial. And then take it, put it back in your body.
What else we got? I crack 3 to 4 fresh laid eggs in protein shake. Can't even taste it. Oh, you go the Rocky Balboa.
Yeah, I mean, some people like to do that. I mean, in theory, there is some risk of doing
Salmonella or
yeah. Sal may pop up. He may show up, and that may make you lose weight. I've had patients that have done that and had a bad outcome. I've had patients that, without realizing, went to a gathering and had some raspberries on a buffet and got really sick. They ended up having cryptospora. It's a weird, not too common bacteria, but they lost like 25, 30 pounds because they were just in the bathroom all day. Crazy but true.
Yeah, that's scary.
Got to cook things at least a little bit.
I had a bad experience in the Barcelona airport. It gave me something I came back with. It wasn't a fun time.
Everyone's got a bizarre story about that. A few years ago, I was planning to go on my usual summer trip to Monaco and Saint-Tropez. I was leaving on a Friday. And Monday I went to a restaurant, nice restaurant. I've been there many times. It was Monday. They had a big, beautiful seafood salad. So I said, oh, I haven't had seafood salad in a really long time. Forgot it was Monday. I had the seafood salad. It might have been the seafood salad from last Friday.
Yeah.
I got home. I was just in another world. Of course, it was coming up this way, going out the other way. It was just, I don't want to get more graphic than that, but it was unbelievable. And I lost 15 pounds between that Monday and that Friday. Of course, I was able to get on the plane and go for my trip because it was pretty much done by Thursday evening. But I was in a rough spot. But I was lean. I was able to go on vacation. And then, of course, when I got there, I ate everything in sight. So it happens.
Oh, man. If you're broke, ground beef or even frozen hamburger patties you will lose a lot of weight. I had a friend in college who did that. Just got to stay away from the carbs. That's really,
Yeah, I mean, there are extremes in every idea and every diet. I don't think you have to be extreme. I think you could have lots of good vegetables. They're good for you. The roughage is good. Some people have too much meat. They get constipated. A lot of people that did the high meat type diets, they'll end up having problems with their gallbladder. They can get constipated. So you got to feel your body out.
Let's see what else we got. I have 12 chickens. I don't wash the eggs. Never gotten even slightly sick. I wouldn't eat raw store-bought eggs, though. They're usually old.
Well, fresh chicken are the best. I mean, I can tell you for many years I've gone to Europe.
It's so different.
And there are times I stay in a beautiful place about 10 minutes outside of the town of Saint-Tropez. And it's a farm, La Ferme d'Augustine. It's a beautiful old farm. They have a Michelin restaurant. The eggs are out of this world. I've never had eggs like that. They're bigger. They're fluffier. They taste unbelievable. Not like, kind of plain cardboard-like sensation. And they're vivid orangey red. They're just a whole different thing, a whole different bird. But they're organic, and they take care of these birds, and they feed them, and they probably walk them up and down, give them some exercise, take them on a leash, run them around the yard, whatever they do. It's just different. And every day I have eggs every day at their restaurant because they're so amazing and you can't get them here.
It's so different. Yeah, I have a buddy that lived down the street and, they'd have too many. And he comes with this whole thing and it's like the taste is beyond. And then you're like, well, why are those white? Oh, they bleach them. Why? It's like it's down the rabbit hole of
I don't know what they're doing to make the food, taste so different here. But over there, the grains are better. They're non-GMO. They're all organic and phenomenal. So, and almost all of my patients that travel to South America and Europe say, yeah, I could have grains and pasta over there. I lose weight because I'm walking around a lot. I'm not bloated, and I have that stuff here. I feel horrible.
And just real quick, there's a common question we get, but our Jedi legend is asking, is the bone marrow procedure painful? My wife is telling me it's really painful.
It's not really painful. Most people don't complain about it, but I can tell you there's a difference between the way I do it and the way other doctors that are hematologists might do it. So I think they numb the skin, and then they use a device to turn. It may be bigger than the one that we use, but you have to numb the bone. So to give people a little bit of a reference, the crest of the ilium, can we zoom in on that?
Yeah, getting there. Boom.
This would typically be the left side of the crest where your belt sits. You can put your hand on either side and feel your belt and then the bone. It dips down towards the back, and it becomes a fat bump. Some people have bigger bumps. Some people have smaller bumps, flatter pelvis, flatter skin, ilium. But there's a spot we go to there because it's easy to get into. Now, for those people who've ever had ribs or steak, on the bone, there's a thin film called periosteum that if you peel it back, it's kind of like crunchy. Right under that is where the nerves live. So if I take the tiny needle and numb the skin and make a little wheal, W-H-E-A-L, and numb the skin, as soon as the skin is numbed, I go down a little bit more into subcutaneous, numb that, and a little bit more, numb that. I'm numbing in the only thing that you really feel when I do the numbing is the first little stick because there's no numbing agent there yet. So if we do that little stick and you numb the wheel, now you're numb about half an inch down. I'll go a little further, numb it another half an inch to an inch. So we're numbing on the way down. And then when we get to the periosteum, I kind of tap that, but I lay the numbing agent there. So that gives you some pretty good coverage. For some people, we'll put a cold spray on their skin if they're really sensitive, and then they may not feel that little pinch when we start to put it in. But the whole thing takes about a minute and a half, so doesn't take long.
And, Jedi legend, I'm just saying, Dr. Chris's mother, 97?
95.
95?
Yeah.
She got it a month ago.
Yep.
No complaints.
Yep. Funny thing is the hair on the side of her head turned dark, black.
Yeah, from gray to...
I was looking at her like, what's going on? She goes, yeah, my hair's turning black on the side of my head, and she's 95. So we've had a lot of people say their hair gets darker from the stem, so that's not, too unusual.
Crazy. It's incredible what I've learned about this.
Oh, yeah. Yeah, STEM is a spectacular mechanism because it's the only true anti-aging therapy that exists. What else is real anti-aging? Nothing. Is vitamin anti-aging? Vitamins feeding your cells the foods they need, and your cells may do better, but you're not putting new cells into play. You're probably getting better results, better response from your cells with really good vitamin and really good hormone correction, but you're not making younger, newer cells in each of these organs to have a newer population. So they're colonizing. And whatever degenerative disorder you want to talk about, stem cells can help.
She said, well, she's an awesome, tough woman, but if she can do it, I can do it. So
Absolutely.
Tell your mother that she's giving strength to others.
Absolutely. She's listening to the show. I know she is, so we have to give her credit for everything she's done. Yeah, forget it. She and her whole side of the family, you just can't tell them not to do this or that. They're going to do it. Only until recently, my mom was cleaning the windows of the house. I said, what do you mean cleaning the windows? I called her one day. She said, yeah, I'm cleaning the windows. I said, what do you mean? Yeah, I got to get up on a ladder, clean the windows. I'm like, oh my gosh, I never thought about that. So we have a lovely lady that cleans and does her housekeeping and stuff. So we can get her off of the ladder and whatever she's doing to clean the windows.
Can't stop her.
So, and my mom has got the greatest sense of humor. She's laughing all the time. You met her. I mean, you can say something almost insignificant and she'll find a reason to laugh. So I have to explain a little thing and I tease my mom all the time. So a very good friend of mine, Bob, and his wife, Pat, we've known each other for many years. And Bob's wife, Pat, is a great cook. And they call my mom and they talk back and forth. My mom's got a ton of people to call her. When I was a kid, you couldn't use the phone. I mean, there was no call waiting because she'd be on the phone for like 3 hours with whoever she wanted to talk to one day, another 3 hours the next day. This is true. So she might be laughing right now, I hope. So, Bob said, oh, we want to, I want to go and see your mom. I'll be in Malvern. I'm like, yeah. I said, does she need anything? I said, well, she kind of would like an artichoke pie. So I said, I asked her the other day, and, she said, she'd like to have an artichoke pie because we know Pat makes the artichoke pie. And Pat makes a spectacular artichoke pie. Artichoke hearts, garlic, mozzarella, and a deep dish pie crust. It's unbelievable. Oh, he says, oh, okay, so I'll get her to make that. So Bob calls her and says, hey, I want to come over tomorrow, and Pat made the artichoke pie. My mother said, what are you talking about? He said, well, didn't you, tell Chris that you wanted artichoke pie? She goes, that scoundrel. So she ratted me out. I'm just trying to get her to make the artichoke pie so I can go over there and have some. I even told her, yeah, my mom likes to have two, one in the freezer and one that she could eat, every day. And I also told Bob, I said, the people from the church come to give my mom communion, and I overheard her saying it. She was saying a little prayer. She said, oh, please get somebody to make me an artichoke pie. Of course, when my mom found out that I said all this stuff, she was both angry and laughing like crazy. So that's what she's doing now. So, yeah, the best personality you could imagine.
So good.
But that's what we do. We
You're a ball buster.
Yeah, you got to be.
I have neglected our YouTube chat for a few minutes. I do apologize. It's Rumbles Day, all right? So you're put on the back burner for a moment. It wasn't on purpose. But said, happy Memorial Day. Can stem cell therapy rejuvenate the gallbladder and function? And what peptides can help?
Well, it can go to everywhere your blood flow, carries. So if a person has gallstones, it's not going to change the stones. If the gallbladder is worn, just like any of the organs can be worn, I imagine it's going to create some benefit. It just depends upon the specifics of that gallbladder problem. For a lot of people that have gallbladder problems, we just tell them to keep the fat percentages down because you're not asking the gallbladder to work like crazy overtime, taking, bile and making it squirting it into the intestine to break down fats. So we want to take the pressure off your gallbladder.
All right. Forgive me for the I'm not gonna pronounce this correctly. But what about NMN or nicotinamide riboside for anti-aging?
So NMN is not NAD. And you'll see people talk about this all the time. These are heavily advertised, and the advertorials are crazy. And people think, oh, I get this pill, which might be a precursor, and I'm going to get the result as if I had the actual NAD. We don't see that. So because I examine people, test people, talk to people, document everything with every patient, I've seen people try every vitamin, every cofactor thing, everything you could imagine in 37 years. And if something works, I'll be the first one to say, hey, it works, I've seen it. If it doesn't work and people say, I've tried the NMN and didn't get any benefit from it, and then I say, okay, well, let's do a little different. Let's try the NAD. And just inject the NAD with an insulin-sized syringe into the skin of your belly or your leg, and then tell me how you feel. And all of a sudden people say, wow, my energy, my mood, my focus, my concentration was great. You feel it. And most people, and we have thousands of people doing it, will feel it quickly, over the course of 15 to 20 or 30 minutes. So, and that's everybody. I've never seen anybody who said, oh, I took the NAD shots and didn't feel it. So it's all about specificity. And remember, people that are recommending these other precursor things are not doctors that are examining people and talking to them and finding what works and what doesn't work and doing testing, et cetera. So there are a lot of advertorials out there to make you think that you should buy something that may not work for you. Also, these people don't know anything about your body, and I know everything about your body because we're doing the blood test.
When you take bone marrow out, will it grow back, the marrow?
Great question. The absolute answer to that is yes. So usually, and this has been documented, between a week to 2 weeks, what you take out is back to normal. You take out about 60 cc's, which I'm trying to think of something that would be 60 cc's. Oh, maybe around a shot glass size of liquid. Maybe a little bit more than that. And there are people that want to do a double extraction, so we do 60 cc's from each side. It's 120 cc's. We've done that for diabetic patients. A gentleman who was in Vegas and was having a rough time, and now he's like $1 million. He's doing great. Non-diabetic, by the way. So yeah, it's not a ton of liquid, but as you extract it, it's back to normal within 2 weeks.
Wild.
Absolutely.
Someone's talking about Dr. Artist, the nicotine guy. Not sure.
I've seen comments. I've seen some videos, but I'm not 100% sure. Because anybody who recommends something for everything and talks about cures and blah, 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 I tend not to believe. But again, I haven't gone heavy into researching it because, if I have time to research things that are good and are warranted and I think need attention, I'll do that first. But I'll look.
We love Frankie. I love you too, all right?
Look at that.
Look at that. I got some love in the chat.
Frankie's got some love going on. That's good.
Thank you, Deplorable Mama. Appreciate you. Love the name.
You're deplorables. Proud to be deplorables.
That we are.
For sure.
All right, let's see what else we got. More questions about this lady that fled to Mexico. We're going to look into that. We'll talk about it next week. We'll see.
Well, you know what? We may have to pop YouTube up to make sure because I have somebody who just texted me that they're trying to look at the podcast.
We're live on YouTube.
Okay.
Yeah. We're good.
Okay.
But you got to send them to Rumble. Got to send them to Rumble.
Rumble. Very cool.
It would be nice to jump or even run. Oh, wait, I'm missing some stuff. Okay. I ask a lot of questions because my body has been through a lot for 35 years. Juvenile diabetes and kidney failure. I was once a super athlete and now I can barely walk at 41. I have neuropathy. It would be nice to jump or even run again, even if it's not fully there and feeling. So this has opened up a lot of doors I was told are forever closed to me by a lot of other doctors.
I may disagree with that. They may not be lying. They may not have any ideas to how to make your body better because their main focus is going to be giving you meds. We've treated type 1s. Of course, we treat tons and tons of type 2s, but I've treated type 1s that have significant improvement. Remember, your pancreas is still attached. It's not like it's gone. They can't take it out. So the blood flow that goes to your pancreas that carries stem will carry stem, and you'll get new cells to help to make some more of your insulin. For neuropathy, we also will trace where the neuropathy is and inject stem right down the leg or into the area where the neuropathy is. And stem cells are pretty cool. They can find the areas of damage and degeneration and go there. So I think you have some potential significant benefit there. Besides helping your kidneys, your liver, your heart, your brain,
So I just had a computer crash. This is a rare one for me, but I think we're still live.
Okay.
Still live. But I just want to follow up with you because, learning from Dr. Chris, it's like, a lot of these doctors just, they're helping you to the best of their ability, but once you go down this road of, not the meds.
It bugs me a little bit because, I'm on the computer every day, whether it's at home or at work. I'll be on the iPad. I'll grab articles like I do all the time here, 5 or 6 articles. And when I have nothing going on, the dogs are not bugging me, and they're relaxed and chill, I'll just get on and look at stuff and find new things to look at and think about. I don't understand why other doctors don't want to do that and look at info on STEM. On one hand, is it just doctors do what they want to do and don't step out of that, realm? Maybe. And there are great doctors in every realm. There are. I just wish that some of them would do a little search, look, learn a little bit and, add. I do have doctors that refer to me. You remember Phil, the patient we had with the stroke, and we had a great video with him. He went back to see his neurologist to get Botox injections in his neck because it was all twisted. But after STEM, 2 or 3 months afterwards, he didn't have the need for that. So, they called to make the appointment for him. He walked through the door and the guy said, "What the F word? I don't understand what happened." And he explained the whole thing, and the doctor was blown away. Because if you don't look and research or learn about this, then you're not going to know. He explained everything. That afternoon, the doctor called me. He was like blown away. So he sent me all of his Parkinson's, almost all of his MS patients, and people that had all these neurologic issues. But, it's not hard to learn and do a little research. Granted, you don't have to be, a rocket scientist or a physician to read some of the abstracts and the conclusions that says this is safe and effective every time, and this works, and this is what we found. Anybody could read that. You may not understand the statistical analysis and how they do that part. I don't even understand that. I just go right to the conclusion.
And all these different patients he's talking about, if you do go to the website, which is right there, you can see all of these patients telling their own stories themselves. It's something else, I will say. And we do have this question, changing topics a little bit. Is it true that ivermectin can cross your brain's blood barrier and harm you if you take too much?
Well, there's no recommendation by anybody to take too much. So there are people who take it once a week, sort of as a prophylaxis, to just have on board. And there are other people who take it. It's been around for a very long time. It's a Nobel Prize winning drug. It's not a horse drug. People, if you look at every drug that's ever made, they've been used on animals before humans. So they're all animal drugs, right? Every stitch of research on every drug that's ever been made is used on animals in trials and studies before it gets to humans. Who cares if it's a horse drug? It works. I read something the other day that there was, in 2005, I think, a publication in a virology journal, very highly regarded, that talked about hydroxychloroquine and its benefit against COVID viruses. Yep. Dig, people. Read, look, scan, get on Google Scholar, look at stuff.
Yeah, I was just going to say that. Google Scholar, guys. Google
Gotta
is
love
not
it.
the same as Google Scholar. Google Scholar is everything is, it's peer researched, all,
Yeah,
cut
it's from
through
some
the
of the
bowl.
best journals in the world. And I don't want to say it's like Expedia, but if you go look at airlines, Expedia will have a whole bunch of things from everywhere. If you look at regular Google, you'll find some research, but you'll find a lot of just regular comments by people that are not doctors or researchers or PhDs, and PhDs do some of the best research, by the way. You go to Google Scholar, it's all heavy-duty stuff. So, you should love to read that. You'd love it. I tell people to do it all the time.
Just got the chat saying this has been highly educational for me. We
Good.
love that.
I'd
And
love
just
to hear that.
to the LFA audience that is watching, we try to mention this every time, but we're not only on Saturdays, we're only on LFA on Saturdays. Maybe things will open up during the week, but Mondays and Fridays, YouTube, Personal Rumble, all the Optimal Health Program, Dr. Chris. You could find us Mondays and not this coming Monday, but Mondays, Fridays on the personal channels as well. So you don't only get us once a week.
But we're working on it. We are not lazy. We are working on this. As we're working on so many different things with our great friend Mike Crispy and a bunch of other people.
The chat should know Mike.
Trying to get the good word out there, Trying to reach the right people.
Exactly.
Interview some cool people. Working on it.
Working on it. I can't wait for that. What else we got? There's people saying have a great weekend. Happy Memorial Day.
So let's talk about Memorial Day food. Dare we? Uh-oh. Everyone's going to turn off the channel now. Eat healthy. Go get some good vegetable stuff. Make yourself some good vegetables. You can take eggplant, grill it, bake it, chop it up. You can make baba ganoush. You can have tons of stuff. There's so many good things out there to have. Go online, buy a good low-carb diet book. Buy some books on how to make vegetables. I've got so many of them in the house. And have your protein. Don't go crazy. Nothing bad, just good stuff. No junk. You can get grain-free chips from Siete and have chips and salsa. Who doesn't love chips and salsa? Is there anyone in the audience who doesn't love chips and salsa?
They should be investigated if they do.
So there's so many good things to have. Eat the best food you can, put the best food you can into your system. Just makes sense. Some people get organic chicken, they put them on the grill. I mean, there's so many things to do.
And when you're thinking about picking up those cookies, you got those two guys on your shoulder. It's Dr. Chris and RFK saying, "Whoa, watch it."
I love those memes. That look your doctor gives you when you go to eat.
It's so good.
I'll have to make a cameo of that.
Chat's quieting down.
Okay, so we're doing really well. Thank you for listening. I mean, I know everybody's going to get ready to go out and do their thing and take the holiday week, and I've got some stuff to do as well. So thank you for listening. God bless you all. Have an amazing day. And we'll be back with you next week. Again, you could look at all the podcasts we've done over the past few months on YouTube, and certainly look at the videos on the website, drcalapai.com, drcalapai.com. The office in Garden City, 516-794-0404. Thank you for all of the emails for those people who want to come in. I love that you email first. You want to get some info. We set you up, get you in. A lot of telehealth we're doing. If you're not near the office and you want to do a vitamin consult, you can do that via telehealth. We can try to get your prescription or maybe a lab to get to you, to get your blood done, review it with you, and then put together recommendations for nutrients, a lot of different things. Just give us a call. We'll show you how we can help you out. God bless you all and have an amazing weekend.